When applying for health coverage during open enrollment, make sure you think about what might happen in 2019 that might make you eligible for a special enrollment period. If you think about it now, it might make it easier to make some plan adjustments later. We're going to walk through a little bit of a special enrollment period scenario and talk about some plan restrictions that might apply if you switch in the middle of 2019. So let's talk first about open enrollment. We know it runs November 1st through December 15th. This is for health coverage that begins January 1st, 2019 and should cover you for the entire year of 2019. You can sign up at healthcare.gov. That's where you can pick a plan, make your plan selections, get ready to pay your first premium, and be ready for coverage that starts January 1st. That is your only window to buy health coverage unless you meet a qualifying life event that could trigger a special enrollment period, such as a change in qualifying coverage. If you lose your job and therefore lose your insurance, you then might be eligible for a special enrollment period to pick a marketplace plan. Or if you lost Medicaid because your income went up, then that's a special enrollment period to buy a marketplace plan. Maybe you have a change in household size, you've gotten married or added a dependent, had a baby. Maybe you changed where you were living, change in eligibility, or change in eligibility for financial assistance, other enrollment or plan error, or a very broad other category of exceptional circumstance that could otherwise qualify you for a special enrollment period. For the more commonly used special enrollment periods, change in qualifying coverage, change in household size, and change in primary place of living, if those happen and you're eligible for a special enrollment period, there might be some restrictions put upon you if you start 2019 with a marketplace plan and then qualify for a special enrollment period. Hence the advice to think ahead when you're picking your plan for 2019 with the idea that if you have a life change that you know is coming in 2019, start thinking about that now when you pick your plan. Here's the way that the rule kind of plays out, and this is new for 2019. If you already have a marketplace plan for 2019 and you experience a change, such as a change in family size or loss of coverage, you may be subject to what is called a plan category restriction. Now, plan categories are those tiers of plans that appear in the marketplace, which are the metal tiers: gold, bronze, silver, platinum. Those are plan categories. So a restriction may apply if you have a marketplace plan, you experience a special enrollment period qualifying event, and you want to change from your current plan to a new plan. The restriction might mean that you may only be eligible to select a new plan only in the same plan category as what you had when you started 2019. So here's one example. John has a gold marketplace plan. His plan category is gold. In June of 2019, John moves from Wisconsin to Illinois and qualifies for a special enrollment period because of change of primary location. John might be subject to a plan category restriction. That means when he buys a new plan, because he's eligible to through a special enrollment period, he can only select plans from the same plan category, which means he can only select another gold plan. He can't pick a platinum or a silver plan. He has to stay in the category. Here's another example. Say you're adding a dependent. You know that you're going to be getting married or you're going to have a baby at some time in 2019. Consumers can use, if you're adding dependents, consumers can use a special enrollment period to enroll in coverage together. So let's say a husband and wife are going to be getting married. You can enroll together with a special enrollment period. But if there is an existing enrollee, one of the couple already has health insurance through the marketplace, she must add new household members to her current plan, or those dependents can be enrolled in a different plan of any category, but the original enrollee can't change plans now that there's a special enrollment period where a dependent is being added. So these are new variations to special enrollment periods that can be quite complicated and will take a little advanced planning to make sure that people can keep the plan that they want or something similar to it, thinking in advance what might be different in the year ahead. One last example, which is a little bit different. Let's say if you are newly eligible for cost-sharing reductions, which means your income is between 100 and 250% of the federal poverty level. Let's say you started a little bit higher income at the year, but then you qualified for a special enrollment period because your income dropped quite substantially and put you into the range where you might now be eligible for cost-sharing reductions, which is a little extra assistance to pay for out-of-pocket costs in the marketplace. There's a narrow range of eligibility for that, and you have to be enrolled in a silver tiered plan to take advantage of cost-sharing reductions and fall within that income eligibility range. If you're newly eligible for cost-sharing reductions, the marketplace will let you switch into a silver plan category to take advantage of that cost savings. So that's one example where maybe you had a gold plan to start, your income dropped, you became eligible for cost-sharing reductions, but they would only apply if you had a silver plan. You will be allowed to change into a silver plan. So, if you're already insured through the marketplace for 2019, and if you qualify for a special enrollment period during the year, just to recap, you may be limited to selecting coverage only within the plan category you chose during open enrollment. So prepare. Think of any chances you might have, any changes that you can anticipate that you think you're going to experience through the year. Think of them now. It may impact your plan selection during open enrollment, and a lot of these things are hard to plan, but if you think there's going to be a life change happening, think about what kind of coverage you want after that life change when you're shopping now. There is a little bit of help from the Centers for Medicare and Medicaid Services on this. They have some fact sheets, they have some webinars, and they have other instructional information about special enrollment periods generally that you can visit. You can also send us your questions or comments, and you can do that at healthwatchwisconsin.org.